I'm here with Johnny from Vitality Chiropractic. He runs a very successful clinic in Newcastle, and Johnny has gone from around 13 to 20k.
Pretty much doubled my new patients. We never used to advertise before, it was always word of mouth. The more people, new patients who get through the door, then it has a knock-on effect. I'm getting more regular new patients because I'm seeing more of new patients from you guys. It's kind of exponentially increasing. I haven't had to go out and do spinal screenings and health talks, and you pay for what you get.
Yeah, hello, everybody. I'm here with one of our favorite clients, Johnny from Vitality Chiropractic. He runs a very successful clinic in Newcastle. So we've seen, been working together around 6 months so far, 6 months or so. And Johnny has gone from around 13 to 20k per month. So he's got some really good, interesting things he's doing internally in the practice as well. That's obviously causing a great amount of success with us. So that's what we're going to cover for you all today. So yeah, just to get started, if you could just, introduce yourself, quick 1 minute, 30 seconds about your business, your backgrounds, Johnny, and how you got into chiropractic. That'd be awesome.
Yeah, no problem. Thanks, Bailey. So I'm Jonathan O'Malley. I have 2 practices. So I'm in Newcastle. I studied at Palmer Chiropractic College over in the States on a rugby scholarship, and then moved back when we graduated and worked in a practice, and then I've had about 4 or 5 different practices that I've kind of worked in and then sold. But we're not doing that anymore, so I'm too old for that now. So our practice is we're seeing them with the help of Align Flow. We're seeing a lot more now, but generally we're open plan, pretty high numbers. But yeah, that's it really.
No, amazing. And Dan actually, he actually mentioned something to me when you first, came on board with us that actually stood out. He said he was really, impressed with how quickly you decided to move forward. And that's actually something we often see as well, Johnny, with our clinic owners that we oversee, who tend to get the strongest results with us. As you have, it's always been, they've been quite decisive. So have you always been like that? Do you feel that's played a part in the way you've approached business over the years as well?
Yeah. I mean, if you're going to do something, you're not going to do it me personally, you kind of got to go for it. Do you know what I mean? So
exactly.
I mean, once we spoke with you guys, I mean, phenomenal kind of intro with you guys, and obviously looked through the other video testimonials and spoke with the other chiropractors who just had nothing but good things to say about you. So I think there was 2 options. It was like pay £1,000 and then for every new patient you get, we give you £100, or it was £3,000. And I just went for, if I was going to do it, you know what I mean? I just went all in it. I mean, absolutely phenomenal results. So I've pretty much always been like that. So
Fair enough. No, it's good. It's really good. So, and another thing as well that we've found with, the clinic owners that we've, had partnerships with and still do, is that there's usually like an interesting path that leads them, into the chiropractic in the first place. So I'd be interested to know, like, what, drove you into getting into, this space and this industry in the first place.
So I've always played rugby, even from a very young age, like 5. So I started, 2 things actually. So I had chronic ear infections. So I had like 7 operations on my ears, and then in my basically kind of 10, 11, 12 years old. And I was also playing a lot of rugby as well, so I was getting a lot of back pain. And my parents used to see a chiropractor, and he was an American chap who studied at Palmer, but he was working over here in Newcastle. So they took me down and sorted my back pain out, but obviously talking about my ear infections, and he said, we'll take a look at your neck and we'll try and sort that out. And I was just like, what? I was like, what are you talking about? I was like, it's just, I've got back pain. You can't do anything for my ears. But yeah, I mean, he went through a course of treatment, obviously sorted my back pain out. That was pretty straightforward. But just loads of stuff on my neck, and my atlas and my axis were really jammed up. And it worked, so it cleared everything out. And I mean, I used to suffer really bad, and then I didn't need any more operations, so the specialists were quite impressed. So then, obviously, I was interested in it from that aspect, but also I played England schoolboy, and then I had a brief
Yeah.
spell at the Falcons,
Nice.
and then it turns out I could actually get a rugby scholarship going to Palmer.
Wow.
So both my brother and I, he played higher level than me, but we both went over on rugby scholarships, and then got to get into chiropractic that way. So we were already interested in chiropractic,
Yeah,
and then
yeah.
it was just kind of, yeah, a scholarship on top. So that was, otherwise we wouldn't have been able to afford to go over there. It was fortune. So yeah, so that's
Okay.
it really.
No, nice one. That's interesting. So you played
Yeah.
rugby at quite a decent level then, and obviously, chiropractic helped you very early on, and now kind of you've took that experience, and now you've got kind of the drive to help other people in your industry, and that's really good, man. That's really, yeah, it's quite inspiring to be fair. No, really thank you for sharing that, of course. And obviously,
Yeah, yeah, no worries.
another thing is like a lot of successful, clinics we work with as well at Align Flow, they do tend to be, very intentional about how they structure their consultations. So I would be interested because, it sets the tone for everything that follows, right? So now you've got into the chiropractic space. So over the years, can you just walk us through your consultation process? Because I'm sure that there's a lot of people who are going to be very interested. Someone who's kind of grown with us from 15 to all the way up to kind of 20, how they're kind of running their consultation process like yourself.
Yeah, so I mean, obviously, it's quite rigorous, all the forms that they have to fill out first. So we ask patients to come like 15 minutes early. So we get all the forms done, and then obviously we take them in the exam room, sit them down, go through everything, the full history. Sit them down, and then I talk them through the process of what we're actually going to do today.
Hmm.
So
Hmm.
they're not like waiting to see what's next. So I'll say, listen, we're going to take a history. We're going to take full history. Um, then we're going to do some orthopedic tests and neurological tests. We're going to check your posture. After that, we're going to pop you on the massage chair, which we've got massage chairs in the clinic, like they do full body, neck, legs, feet,
Hmm.
everything. So after you go on the massage chair, then we'll take you onto the table. We'll have a full field palpate of your spine. Obviously, focusing on the affected areas. We'll do some treatment if it's safe to do so.
Hmm.
After the treatment, we'll take you back into the exam room. I'll talk you through everything what we found today, and then when I take them into the exam room, um, so basically, I'll go through all of that with them, and then I'll explain. I'll say, look, I'll tell you what's going on, and then we'll bring you back for the report of findings, where we'll go through your treatment plan.
Yeah. Nice.
So after I've told them that, which take a couple of minutes, that they know the layout for their visit.
Yeah.
So if they're nervous or anything like that, they kind of know what to expect. So obviously we do the history, do any orthopedic, neurological, which is relevant to their condition. Obviously we always we scan for TIAs, which is very important. Then after that, what I'll do is I'll stand them up against the door in front of a mirror,
Hmm.
and I'll ask them how their posture feels. And nine
Yeah.
times out of 10, they'll say, I'm coming forward. And then I'll get them to look at their posture. We'll obviously test the range of motion with the lower back, if it's a lower back issue, with the neck issue, just so they have a kind of benchmark. Then we'll put them on
Yeah.
the massage chair. We'll adjust them. Then we do flexion distraction if it's safe to do so.
Hmm.
And then, but then what I do is I'll bring them in the room and I'll stand them back up against the door.
Yeah.
And automatically the head will hit the door, or they'll be standing straight in. They'll feel a lot better. And then I'll recheck their range of motion so they see the results. And then I'll take them through the spinal model where we found, and so they go away and they already know what's going on.
Hmm.
And then I'll
Hmm.
just say, look, I'll have to put this together in a treatment plan, and then we'll bring you back next time. And then obviously they come for the report, and then that's when I say, look, you're gonna need a couple of visits. Look, you're gonna need a treatment plan. It all varies, but I mean, it's it's not a one size fits all for me as well. So I
Yeah.
mean, before we contacted you guys,
Yeah.
and it wasn't that we were struggling. It was just I'm not on social media. I'm not in any of that stuff. I check my emails and that's about it.
Yeah.
But a lot more chiropractors are coming around, and there's a lot more social stuff. So patients are saying, "Oh, have you seen this guy? Have you seen that guy?" And I'm just like, "Oh, well, I need to do this,
Yeah.
but I didn't want to kind of half kind of do it. So that's why went with you guys, the professionals, and that's why I just went all in. And I was at a seminar not so long ago, and there was a guy there who was on all the socials, and he said, "Oh, how are you doing?" It was the first time I met him. He was a Canadian chiropractor in the area, and I said, "Oh, I've seen you on all the Instagram, all the stuff patients were saying," and they were just like, "Are you joking?" And they were just like, "You are absolutely everywhere."
Nice.
He goes. He just said you can't type your name in without. I was like, "Oh, really? I didn't even know." So that's
Yeah.
obviously you guys. Yeah, mate. So that's it, really. So,
No,
and
no.
then, yeah, so like I was saying, sorry. So before I came to you guys, I never used to advertise
Yeah.
because I don't do just one treatment plan for every patient, So
Yeah.
if someone only needs a couple of visits, I'll do a couple of visits and then I'll say, look, there is a benefit from maintenance.
Hmm.
These are the benefits. It's up to you if you want to do it, So I think not a lot, but some chiropractors kind of they give the hard sell, and then you don't get a great reputation. Do you know what I mean? So,
Yeah.
but
And
yeah, so that's
yeah,
it.
it is quite interesting because that what not that kind of one size fits all approach isn't for you, and that's great. Have you found that process you've just outlined to be because we just get you. We've been your results are insane with us. Like we're getting you back to back bookings on a consistent basis, which is fantastic. Have you found
Yeah.
that process, even at this larger scale, larger volume of clients, to be helpful? Has it been a good kind of choice?
What's that? Which process? Sorry.
Yeah, so the process you use right now, that one size fits all, that approach that doesn't that fit for you, the consultation process essentially, have you
Oh
found that
yeah,
even on an
yeah, yeah.
increased scale of volume to work successfully for you?
Oh, manageable. Yeah, yeah,
Yeah,
yeah. No, completely. Yeah.
amazing.
If anything, it's because I'm seeing that many more new patients now. It's got even better. Do you know what I mean? Because
Yeah.
it's. I mean, I think pretty much double my new patients. And then obviously on the back of that, we're getting, because that's what I was going to say. So we never used to advertise before. It was always word of mouth because we
Yeah.
have a good reputation. So the more people, new patients who get through the door, then it has a knock-on effect. And not, I'm getting more regular new patients because I'm seeing more of new patients from you guys.
Hmm.
So it's kind of exponentially increasing. So I mean, this morning we've been absolutely manic. We've probably done about 40 patients this morning with like 3 new patients on the end,
Hmm.
So
Yeah.
it's and I've had to open two extra shifts, so which I
Wow.
was more than willing to do.
Yeah.
So it's good, and then we're getting a digital X-ray machine in here in the next 10 weeks, so we wouldn't have been able to do that. So yeah, so it's good, it's
Nice.
exciting.
Big
So,
move.
but if they, it's definitely give us a kick up the backside, that's for sure.
Yeah, nice. You're a lot busier by the sounds of it, which is a really good thing. A really good thing, and it's interesting
Yeah,
as
I mean,
well. Go on.
yeah. So I mean, the good thing about being busy, really busy, is you see where the cracks are in your clinic as well.
Yep.
So it's like if you're playing a sport, if you play against a rubbish team, you don't really test yourself, do you? But
No.
when you're playing against a really good team, or you've got tons of patients, you see what needs critiquing in the clinics and like
Yep.
certain processes that need fine tuned. So it's been great for the clinic as well.
Yeah. Yeah. No. I fully agree, and that's good. That's why we're here at the end of the day. And one thing I did notice as well, whilst you was just outlining the your approach, the consultation process there, with our more we work with a lot of big established clinics, and they tend to be just like you, like very clear on matching patients to the right level of care rather than just taking a one size fits all approach. So how do you decide whether someone is suited to, say, a full care plan versus a smaller treatment or single session, for example?
Yeah, so I think it comes with experience,
Yeah.
So unfortunately, you learn a lot at university, but you don't really start learning until you get out there.
Yeah. Yeah.
So yeah, so it's yeah, so but generally, if the patient's had a problem for a long time,
Mm.
we're not going to fix it in overnight, But say I had a new patient this morning. Actually, he's a really fit guy.
Hmm.
He's never had any problems. Goes to the gym a lot, and he's just popped a rib out in his neck, So and he's only had it a day, So he's come straight in. So for me to say, oh, look, you're going to need 12 visits, you know,
Yeah.
like he'd be like, what? I've never had this problem before. I've only had it a day. Like there's no radicular arm pain. It's just localized. The muscles spasmed. So literally, it'll be a few visits, and then after that, I mean, I've already said, listen, and I say that kind of in the new patient exam, like I'll already kind of plant seeds into what they need, or the fact that maintenance is good, just
Yeah.
with little things that I say, because it is good, and it's
Yeah.
not a trick or anything like that, but it's just so they don't get a shock when I say, look, you should probably think about coming, because you go to the gym. This guy in particular, I'll see him twice, but he's already said to me, do you think this is something I should come and like kind of get maintained, because he feels really good? And I just said, yeah, definitely, you know, but it'll only take a couple of visits to get him out of pain. His posture's fine, so there's no need to do a treatment plan
Yeah.
as such. But there is a need to do maintenance, because everyone benefits from maintenance, you know.
Yeah.
But
Of
say it's
course.
someone, another new patient this morning, she's low back, leg pain. She's had it for 3 years. She's a little bit older, so yeah, it's going to take us 12 visits to get that sorted.
Maybe longer. Yeah.
But likewise as well, if I think something is beyond my scope, say if it's a medial disc herniation, then we'll refer probably for MRI. And then if they're not, for patients like that, where I will also just say, look, just do visit by visit, because the worst,
Yeah.
not the worst thing, but when someone buys a care plan, if you're not seeing any results after like 6, 7 visits, 9 times out of 10, I'll say, look, we need to stop care. We need to refer you to an orthopedic. We need to get an MRI. And it's a bit of a pain, you know, having to refund them and everything like that. So
Yeah.
it's better to do it that way.
Yeah. No, you've clearly got a big passion for this. I really like your answers here, my friend. They're really good. So, and that kind of, it's
Yeah.
interesting because one thing as well, that must, it must kind of contribute to, not only our success, your success is, like the mindset behind all this as well. So when you're about to see a new patient, for example, I'm interested to know, like, what's your mindset like at that point?
Be friendly, super friendly, approachable, and just casual, you know.
That's it.
So not too casual though, you know, not too casual, but the main thing is just be warming, you know, kind of, unless they've seen a chiropractor before, then a lot of people are going to be nervous, you know, and even if they have seen a chiropractor before, they're still going to be a little bit like, you know, even if they've been recommended and that sort of thing.
Yeah. Yeah.
But ultimately, it's to put them at ease, find out the problem, and get it corrected, and
Amazing.
obviously keep the patient happy as well.
Of course, of course. And
Yeah.
finally, like we always, on these calls, we always like to pull like practical insights from, clinic owners that could actually, that other clinic owners could actually put into their practice as well. So like, what are some, I guess, insights, tips, or approaches you've used on this journey with us together, in your clinic that other clinic owners watching this could possibly learn from when it comes to like, communicating care or improving conversions, for example?
Basically, I mean, improving care and conversions. So improving care, it's just you've got to treat each patient individually. Even if you're seeing high numbers, you've got to know your patient inside and out.
Yep.
So I always check the notes before each visit. I've got a pretty good memory, so I genuinely remember a lot of patients anyway. But
Yep.
still double check their notes just before they come around for the adjustment, so you know what's happening. Just remembering things about the patients. You know, if I haven't seen a patient in a month, but I'll remember that they've been on a cruise to Miami, and first thing I'll say is, how's your holiday? You know, people like knowing, because especially in a busy clinic, they don't want to feel like they're just on a conveyor belt, you know. So you've got to kind of personalize each visit. So you've got to be switched on for if you're seeing high numbers, you've got to be switched on for each each shift. I review every patient, but right before the shift, I go through it with my front desk as well. Oh, she's had a foot operation. Make sure we don't put the feet on the massage chair. Like just little things, you
Yeah.
know. So it's like going through. It's like a run through for a sports team. Do you know
Yeah.
what I mean? So you'll do a run through pre-game, and then for conversions. Um, one of the things I say to patients who've had a problem for a long time and they need a care plan, I'll say, listen, what we're doing here is much like when you go to the dentist and get a brace on your teeth. It's
Hmm.
a gradual process of straightening. It doesn't happen overnight or in one visit, you know. So when you've had a problem for this long, which is true, you know, we have to retrain the spine, the muscles and the soft tissue which attach into the spine, that the position that they're in now is not the correct position. So it's going to take us a little bit of retraining to get you back to where we want you to be.
Amazing.
And generally that resonates with patients and they're like, oh, right, yeah, it makes sense. You know, so it's kind of just making comparisons that they understand. You know, so if you start talking about the innate nervous system and the parasympathetic and sympathetic nervous system, they're just going to be looking at you like, what are you talking about? You know, so you've got to kind of
Yep.
make it in not too simple, you know, but in terms that they understand.
Of course. I do have one final question for you, my friend, and it's over the past, we've been working together for 6 months now. So yeah, would you recommend Align Flow?
Oh, 1,000,000%. 1,000,000%. It's yeah. I mean, it's completely changed the practice. You know, so it's we were already seeing good numbers, but now we're where I want to be, high volume, and I haven't had to go out and do spinal screenings and health talks and blinking golf clubs and stuff like that, and it's just you pay for what you get, you know. So it's patients will come in here, and I mean we are pretty reasonably priced, but I've got no problem telling someone, listen, you need to pay X amount for 12 visits because it's going to work, you know.
Yeah.
So I've got no problem paying you guys because it works. So as long as you're prepared to put the work in, you know. So you've got the mindset of you're going to be very busy,
Yep.
you will massively benefit from it. If you just want to kind of average, lazy, not average, but if you just want to kind of quiet day and you know what I mean, you want to see like 10 patients, 10 adjustments in a shift, then it's probably not for you. But if you want to see high numbers and get new patients through the door without you having to do anything, then 1,000,000% Align Flow. So we'll not be going anywhere. So we'll be using you guys for a long time.
Amazing. Amazing. Thank you very much for your time today. And yeah, we really appreciate you coming on.
No bother. Yeah, anytime.
Amazing.